Hello, everyone. Thank you for joining the Office for Human Research Protections webinar series on the Common Rule. Today's webinar, Before Saying I Do to the Common Rule, Figuring Out Engagement, will be presented to you by Public Health Program Specialist Michael Grappaldi. This webinar will be recorded and will run for a total of 60 minutes, including a live Q&A session. If you have questions, please submit them through the chat. Certificates of attendance will be issued to all who have registered. The slides will be available on OHRP's website under the past events section, and the recording will be available in around a month. So we will go ahead and get started.
Good afternoon. This presentation is titled Before Saying I Do to the Common Rule, Figuring Out Engagement, and is sponsored by the Department of Health and Human Services, Office for Human Research Protections, Division of Education and Development. A disclaimer before we get started: any opinions expressed in the course of this presentation are my own and do not necessarily reflect the policy of the Department of Health and Human Services or the Office for Human Research Protections. Any references to the regulatory provisions in the Common Rule in this presentation have been simplified to facilitate understanding. Always refer to the actual text of the Common Rule available on the OHRP website for a complete and accurate description of the regulatory requirements. In today's webinar, I will explain when to think about the concept of institutional engagement, examine what activities engage an institution, and describe the requirements for an institution when it is engaged. Let's begin with a quick overview. What is institutional engagement? In general, an institution is engaged when its employees or agents perform non-exempt human subjects research that is funded by the Department of Health and Human Services. Notice that institutions are considered to be engaged even though its individuals are the ones performing the actions. So an individual herself is not engaged, but through her actions, she can engage the institution that she works for or represents. Another way for an institution to be engaged is to be the primary awardee, the direct recipient of money from HHS. This seems pretty straightforward, right? Many institutions receive money and conduct the non-exempt human subjects research in-house. But even if that primary awardee is simply a conduit for the money, meaning that it doesn't do any research activities, but passes on the money to have other institutions conduct the non-exempt human subjects research, the primary institution is still engaged. Worded differently, even when all activities involving human subjects are carried out by employees or agents of another institution, the primary awardee is still engaged. So we've talked about engagement when there's one institution, and it seems pretty basic, but when there are multiple institutions or individuals from multiple institutions collaborating on different parts of a non-exempt human subjects research study, determining engagement can become complicated. Some institutions may be engaged while others may not. The key is to examine the research activities of each institution to see if they are in fact engaged, and we'll be doing that later today. When an institution is engaged in non-exempt human subjects research, it must be covered by a federal-wide assurance, or an FWA. And in the case of multiple institutions for cooperative research, the single IRB review requirement might apply, meaning that one IRB will review the research activities of all of the participating institutions. I just provided you with a quick overview, and you'll see many of those points repeated here and again throughout the presentation to emphasize their importance. As I just said, we need to think about engagement when there is non-exempt human subjects research funded by HHS. There are two parts here: the type of research and then the funding mechanism. First, if an entire project across all research partners is considered not research, not human subjects research, or is exempt, then there's no need to go through an engagement determination because it doesn't apply here. But if there is any aspect of a research project that qualifies as non-exempt human subjects research, that means that the entire project is considered non-exempt human subjects research, and engagement analysis should be performed for each institution. Second, consider if the project is conducted or supported by HHS. In other words, does any institution receive money from HHS for this research project? If not, then you don't need to consider the topic of institutional engagement. It's very common to have multiple institutions collaborating together on one research project. When the project is non-exempt, then the activities of each individual institution need to be examined to see if it is engaged. Sometimes this can be straightforward, like in a multi-site clinical trial at different institutions, where each site has participants coming to it. There's an intervention being administered, such as a study drug, and they're recording the same things, and basically all activities are the same. It's very clear that each site is engaged. But other times, this can be a bit more cloudy or muddied. The institutions do not need to be performing the same activities. A study could be divided among two institutions, with one administering an intervention, collecting samples, and then sending those samples to another institution for analysis. In this case, because there is non-exempt human subjects research, an engagement analysis should be performed for both institutions, and particularly the second institution that's receiving and processing the samples. The human subjects activities performed are reviewed to determine whether or not it is, in fact, engaged. Institutions that are engaged will most likely have to have their activities reviewed by a single IRB in collaborative research, which I will speak more about later. Institutions cannot claim that their part in a research protocol is not human subjects research or that it is exempt. This sort of compartmentalization is incorrect. Studies cannot be divided up into these different classifications. The whole study is considered non-exempt, which means all aspects of it are considered non-exempt. Now, if you're someone who reviews proposed research, you may need to ask your researchers more questions to see if their project involves other collaborators. What might appear to be exempt could actually be part of a bigger study that is non-exempt human subjects research, meaning that your institution might be engaged. If an institution is determined to be not engaged, then there is no need to have those activities reviewed by the single IRB. For those of you who regularly attend our webinars, these next few questions will look familiar, and I'll just kind of go through them quickly. When determining if something is non-exempt, we ask the same three questions. First, is the project research? Is it a systematic investigation? And breaking that term down, a systematic investigation generally refers to a methodical approach to the activity, likely involving a hypothesis, research question, and a plan to systematically collect and analyze data. So is this investigation designed to contribute to generalizable knowledge, to add to the body of existing work that's there? If no, stop. It's not research, and you don't need to ponder the concept of institutional engagement. If you answer yes, then you need to ask the second question, is it human subjects research? Generally, if an investigator interacts with a living individual, asks them to take part in an intervention, manipulates their environment, or collects identifiable materials about them, it's human subjects research. But also, the researchers may not have interacted or intervened with the subjects at all. Human subjects research can also occur if investigators use identifiable private information or identifiable biospecimens. An important aspect here is whether the information or biospecimens are identifiable. That is, the identity of the person is either known or can be readily ascertained by the investigator. If the activity is not human subjects research, then you don't need to think about institutional engagement. But if you answered yes to is it human subjects research, then you need to ask, is it exempt human subjects research? Look to see if the project as a whole qualifies for an exemption category. If there is no applicable exemption or exemption categories that apply, then the study is going to be non-exempt human subjects research. We've seen some confusion on this point, so it's worth repeating. As I've mentioned multiple times at this point, the concept of institutional engagement only applies to non-exempt human subjects research. So if the only involvement of human subjects fits into one or more of the exemption categories, and that's right, you can combine the exemption categories, then you don't need to worry about engagement. But this applies to the whole study, not just one institution's part. And you'll see the red bold here, it's because of the only involvement. And so in cooperative research, it's necessary to take into account the activities of all the institutions, not just one or not just your own, to see what all of the collaborators are doing. Dividing up a non-exempt human subjects research protocol amongst different institutions is, of course, allowed. But what isn't permitted is an institution claiming that its involvement qualifies as exempt when the study is non-exempt. Now, it's quite possible that that institution, when an engagement analysis is performed, might turn out to be not engaged, but it can't claim that its work is exempt. Here's a visual representation of when to consider the concept of institutional engagement. First is the project research. No, then you can stop right there. You don't need to consider institutional engagement. But if yes, the second question is to ask, is it human subjects research? If the answer is no, then again, you can stop. You don't need to examine engagement. If it's yes, then we're asking, is the whole research study exempt across all the different collaborators? If yes, then again, you can stop. You don't need to examine the concept of engagement. But if the study is not exempt, then we have non-exempt human subjects research, and it's necessary to look at the activities of each institution to figure out whether or not they are engaged. Now, with the prerequisites of non-exempt human subjects research and HHS funding in place, let's take a closer look at institutional engagement and see what types of activities engage an institution. It's worth mentioning again that receiving money directly from HHS engages an institution, even if all it does is pass that money on to other institutions that complete all of the non-exempt human subjects research. Directly receiving funding from HHS is an activity that engages an institution. But what human subjects research activities engage an institution? Well, the default is that interactions with human subjects for the purposes of research will engage an institution. Remember, interactions include communication or interpersonal contact between investigator and subjects. Interventions include physical procedures by which information or biospecimens are gathered, and manipulation of the subject or the subject's environment for research purposes. Beyond that, accessing identifiable private information or identifiable specimens for research purposes also engages an institution. Lastly, obtaining consent engages an institution. It makes sense that these activities would engage an institution by default because they are human subjects research activities that are routinely performed by investigators and their teams. For instance, someone who's tasked with the responsibility of obtaining informed consent should be intimately involved in the research, so they're familiar with all aspects and can answer questions from the participants accordingly. Recall that institutions are the ones who are considered engaged, but it is the employees or agents who engage the institutions. So, who qualifies as an employee or agent? Those individuals who act on behalf of an institution, exercise institutional authority or responsibility, or perform institutionally designated activities. While in many cases people associate being an employee or agent with receiving a paycheck, it is important to note that compensation is not necessary. That is, an unpaid volunteer can engage an institution. So this runs quite the gamut. So for example, a university could be engaged by activities performed by a wide variety of individuals, not only by someone acting as an institutional official or an IO, but also a professor, a contractor, and even students. The employee-agent relationship is usually easy to figure out because an individual might only be affiliated with one institution, though some individuals might have two or more affiliations. An academic, for instance, might have appointments at a couple of universities, or a physician researcher might be affiliated with several different hospitals and maybe a research center or two. In those situations, it should be made clear on behalf of which institution the individual is acting. Let's take a look at an example. Alpha University receives funding from the National Institutes of Health to conduct a clinical trial on a heart medicine. Dr. Smith from one of the local hospitals is consenting participants as well as performing EKGs for the research. Is Alpha engaged? Well, first, should we even be thinking about the concept of institutional engagement? Meaning, do we have non-exempt human subjects research supported by HHS? Yes. First, the clinical trial is a research study in which one or more human subjects are prospectively assigned to one or more interventions to evaluate the effects of the intervention on biomedical or behavioral health-related outcomes. Here, we have participants receiving the intervention of the heart disease drug to measure its effectiveness. Second, we are told that Alpha is receiving a grant directly from the NIH, which is part of HHS. This satisfies the second prong. Now that we should know that we should be looking at engagement, is Alpha engaged? Yes, because Alpha is the primary awardee of the grant. Now, we do not need to consider what human subjects activities, if any, Alpha is performing, as they are the primary awardee for the grant. This alone engages them. We are told that there is a collaborator, Dr. Smith of local hospital. So is local hospital engaged? Well, is one of their employees or agents acting or intervening for the purpose of the research or obtaining consent? Yes, Dr. Smith is obtaining consent, which engages an institution. Additionally, he's performing an intervention for research purposes. Notice that while administering the heart drug is the intervention being studied, tested, or evaluated, there are other interventions and other interactions that will occur. We'll use this baseline example of a non-exempt human subjects research study funded by HHS throughout the presentation. Engagement can be a very complex topic that hinges on the details and specifics of the activities being performed for research. The general default, as I mentioned, is for an institution to be engaged when its employees or agents interact or intervene with participants for research purposes. But there are instances when these human subjects activities do not engage an institution. There are some carve-outs and exceptions to this default rule. Contrast obtaining consent, which engages an institution, with providing information about the study to prospective participants. To some, these activities might seem entirely different, and to others, they might seem pretty similar. For the purposes of institutional engagement, they are very different, as only providing information does not engage an institution. This means that an individual can hand out flyers, advertisements, even the consent document itself to prospective participants. An institution's employees can provide an investigator's contact information. They can even ask a prospective participant if someone from the research team can reach out to them. And these interactions on their own do not engage an institution. In a way, this is just facilitating the research. These are interactions with people who are not even research participants yet. Recall the facts of the initial scenario. We have a non-exempt study sponsored by the NIH through a grant to Alpha University. Here, Alpha contacts a local retirement facility to help with recruitment into its heart drug clinical trial. Alpha will provide the retirement facility with study literature to give to the residents there. If the nurses, who are employees of the facility, distribute flyers to prospective participants, does that engage the retirement facility? No. Even though there's an interaction between the retirement facility's employees and its residents, for the research purposes of Alpha, providing information is not an activity that engages them. What if the nurses distribute consent forms? No. The nurses are allowed to distribute consent forms as, again, this is supplying information, and the retirement facility would not be considered engaged. Now, if the nurses obtain consent for the Alpha research study, yes, conducting informed consent will engage the retirement facility in the research. This is a distinctly inherent research activity, as we've discussed earlier. In cooperative research, it's very common to have multiple partners performing different human subjects activities. Sometimes a collaborator can perform these as a service and not engage their home institution. There is a services carve-out that does not engage an institution if all of the following requirements are met. The services performed do not merit professional recognition or publication privileges. This would be acknowledging someone for their efforts and/or listing them as an author on a publication. The services performed are typically done for non-research purposes. Typically means over half of the time, that is, most of the time, it's not done for research purposes. And lastly, the employees are not administering the study intervention being evaluated. So some examples of these services could be a transcription service whose employees transcribe research study interviews as a commercial service, or a hospital whose employees obtain blood through a blood draw or collect urine and provide such specimens to investigators as a service. Note that money does not need to exchange hands. That is, this can be a commercial or an other service. Let's look at another example. Alpha reaches out to blood diagnostics to have them draw blood from participants and perform blood chemistry tests. Diagnostics routinely does this service for clinical care. Is diagnostics engaged? The baseline is that diagnostics is interacting with participants and performing an intervention on them for research purposes. So initially, you might think, yes, they are engaged. But what about the commercial services carve-out? Let's review the criteria. Do the services performed merit professional recognition or publication privileges? No. Diagnostics is not doing anything out of the ordinary here that would warrant special praise from Alpha. They aren't contributing independent thought to a manuscript, and it'd be very unlikely to see a diagnostics phlebotomist or lab technician listed as an author. Are the services typically performed for non-research purposes? Yes, we're told that diagnostic routinely performs blood chemistry tests as a service for hospitals. This means that it's for a medical diagnosis or clinical care purposes. So most of the time, they are not performing this for research purposes. The third criteria is if they are administering the study intervention being studied. And no, they are not providing the heart drug. Diagnostics is probably not engaged based upon the services carve-out. Note that there's no mention of Alpha paying for this service or not, as the guidance allows for commercial or other services. Conducting surveys is usually considered a human subjects activity because it involves interacting with participants for the purposes of research and collecting information that can be used in answering a research question. As we just saw, however, there is a services carve-out that might be applicable. To figure out if a survey firm is not engaged, meaning that the carve-out would apply, we ask the same questions, but we need a no for each question for the survey firm to not be engaged. In other words, a yes response to one of the questions means yes, the firm is engaged, and no responses to all of the questions mean no, it is not engaged. First, does the survey firm obtain consent? It's worth repeating since the survey firm might be asked to do this. It's not uncommon to have a survey administered immediately following the consent process. Is the firm receiving professional recognition or publication credit for its work? Are most of the surveys conducted by the firm not performed for the research purposes? Here typically means a majority of the time. This means that the survey firm could conduct some surveys that would be research, but the majority of the work, the majority of the surveys that they administer are not performed for research purposes. Lastly, the administration of a survey generally constitutes an interaction, not intervention. But there could be a scenario in which the firm administers the intervention being studied and then asks about it immediately. This would engage an institution. But for the most part, this last question is a bit of an afterthought when considering the institutional engagement of a survey firm. Let's review a scenario. Alpha contracts with a local college to administer surveys on its behalf as part of the ongoing clinical trial. The surveys will be asking participants about their lifestyles to learn of the participants' behavioral activities. Now, the college has high fees, and it's known for the quality of the work they produce. And despite this, they apparently never seek publication credits. Is the college engaged in the research? Or does the survey firm exception apply? Remember, when we ask these questions, that the answers to all of them need to be no for the college not to be engaged. One answer that is yes to any of these questions, and the analysis can be stopped because yes, the college would be engaged. Well, is the college obtaining consent? No. The participants have been consented and they're already enrolled in Alpha's clinical trial. Does the service warrant professional recognition or publication privileges? No. We are told that despite the top-notch work the college does, they don't seek publication credit. Does the college typically perform surveys for research purposes? Yes. We are told that they specialize in research, meaning it would be a majority of their work. Most of the time, they are administering research surveys. In response to the initial question, yes, the college is likely to be considered engaged. The survey firm exception does not apply because the college normally conducts surveys for research purposes. While we're talking about services, medical services may also be provided by an institution without engaging it in the research if all of the following criteria are met. The services performed would typically be part of routine clinical monitoring / follow-up by clinical investigators. Examples of these would be things like taking a medical history, performing a physical examination, taking an x-ray, things like that. Let's examine more of the necessary criteria. The institution's employees do not administer the study intervention being investigated. By now, you might recognize that administering the intervention being tested, such as giving the study drug, is a human subject's activity that will engage an institution. The medical services are typically performed for clinical purposes. That is, they are primarily performed for non-research purposes. You can see how this item is very similar to the previous services slides that we've discussed. The employees or agents do not enroll or obtain consent. In the STEM, you'll see that the subjects have already been enrolled in the study by the researchers. This is simply restating that point, as well as providing a reminder that obtaining consent is a human subject's activity that engages an institution. Lastly, the researchers are overseeing the procedures and making arrangements for reporting the data, meaning that the investigator's institution requests the services performed and instructs the institution that's performing the services on how to get the research data back to the research institution. Here's another scenario. A participant lives far away from Alpha's clinical trial center, and the window specified in the protocol for an MRI to be completed is closing. Alpha reaches out to a facility close to the participant to have them complete the follow-up MRI on Alpha's behalf. Now, following the MRI, the radiology practice will send the participant's images back to Alpha. Is the radiology practice engaged? Well, let's go through the criteria for the medical services exception. Now remember that they all must be satisfied. Is the radiology practice administering the study intervention? No, they are not administering the heart medication, which is the intervention that's being tested or evaluated in the study. They're performing a follow-up MRI. Does the radiology practice typically perform the MRIs for clinical purposes? Yes, most likely. We are told that the practice is affiliated with area hospitals, so it's likely that the majority of the MRIs are conducted for medical, diagnostic, clinical purposes. Is the radiology practice enrolling or consenting participants? No. This participant has already been consented and enrolled in the study. The radiology practice is not performing either task. Does Alpha oversee the MRI and make arrangements for reporting the data? Yes. We are told that Alpha reached out to the radiology practice to make the MRI appointment and then instructed the radiology practice to send the results back to Alpha for evaluation. In this case, no, the local radiology practice is likely not to be considered engaged in the research. Shifting gears from services, another way that a research project is commonly divided up is to have a collaborator at another institution analyze information or specimens. When an institution's employees or agents obtain identifiable private information or identifiable biological specimens from any source, meaning that they're collected directly from the participant, or they could be already existing. And when these are obtained for the purposes of the research, the institution is considered engaged. This includes, meaning that's just not limited to these categories, observing or recording private behavior, or using, studying, analyzing for research purposes identifiable private information or biological specimens from another institution, or those that are already in the possession of the investigators. The second part here is essentially the second prong of the definition for human subjects research. Let's contrast the previous identifiable information or biospecimen slide to when an institution receives coded information or specimens. Under these circumstances, the receiving institution would not be considered engaged. Now, coded for the purposes of an institutional engagement discussion means the identifying information, such as a name or social security number, that would enable an investigator to readily ascertain the identity of the individual who provided the private information or specimens, has been replaced with a number, a letter, a symbol, or something which is creating a code. And a key to decipher that code exists. So this is providing a link between the materials that are coded with the letters, number, etc., and the identity of the person who provided them. The receiving institution is not engaged when they receive the coded information or biospecimens from another institution involved in the research, meaning that it does not come from inside the same institution, and that sending institution retains a link to the individually identifying information. And then additionally, the receiving institution is unable to ascertain the identity of the participants because there's something that prohibits the release of the key. This could be because there is an agreement between the two institutions stating that the key won't be released to the receiving institution. The IRB of the originating institution might prohibit the release, or there is a legal agreement prohibiting the release of the key. Notice that there is something beyond a handshake agreement. There is always something reduced to writing stopping the receiving institution from obtaining the key and learning the identities of the participants. Let's look at a scenario with information and specimens. Alpha collects identifiable participant information through interviews and pairs this information with blood samples from those participants. Alpha sends both to an investigator at a nearby college for some analysis, looking for a correlation between behavior and high cholesterol levels. Is the college engaged? Yes, the college is obtaining and analyzing identifiable information in biological specimens for research purposes. Recall that it doesn't matter if the institution interacts with the participants or not, or if the samples come from an outside institution. So here, it does not matter that alpha is the one interacting and intervening with the participants, or that the college is analyzing these samples that came from another institution. What matters is that the college is analyzing identifiable information in specimens. But what if the same information in specimens are first coded by alpha, meaning that the identifiable information has been removed and replaced with a participant number, and an agreement is signed that prohibits the sharing of the key, which links the participant numbers back to the identities of the participants? No, the college would not be engaged because they are receiving coded information in specimens from another institution, and the sharing of the key is prohibited, meaning that the identities of the participants cannot be readily ascertained by investigators at the college. Notice how important the identifiability of the private information and biological samples is when it comes to making institutional engagement determination. We spoke of the institutions receiving information or specimens, but what about an institution releasing them? If an institution is not otherwise engaged in the research and is only releasing identifiable private information or identifiable biological specimens to another institution, the releasing institution is not engaged. Now, this does not mean that other policies or regulations would not apply in this situation, just that the institution releasing the materials is not engaged for the purposes of the Common Rule, or CFR 4546. But, for example, if the identifiable private information or biological specimens to be released were collected by another research study that was covered by 45 CFR 46, then the institution releasing the information or specimens should make sure that the consent form from the original study permits the release of the materials. Another scenario for you. Alpha receives permission from the participants in its clinical trial to contact their primary care physicians to obtain their medical records and use these prior medical histories in the research. The physicians will be releasing identifiable private information for research purposes. Does this release of identifiable private information engage the employers of the physicians? Are there hospitals or clinics engaged in the research? No. Providing identifiable information or biospecimens does not engage an institution if that is their only involvement. What if Alpha provides the participant information from their study back to the physicians? Does the data collected for research purposes, when shared with the physicians, engage the institutions receiving it? No, the physicians would be using the information for clinical purposes. They are not otherwise contributing to the research by performing analysis or anything. They would not be considered engaged. Please note in this scenario that there are likely privacy protections in place that might govern the physicians in the release of their patient information, as well as policies that dictate under what circumstances Alpha can release information to other institutions. So we've gone over some rules and scenarios to figure out if certain human subjects' activities engage an institution. So what does it mean if an institution is in fact engaged? Institutions that are engaged in research must be covered by a federal-wide assurance, also known as an FWA. Through an FWA, an institution commits to HHS that will comply with the requirements set forth in the regulations for the protection of human subjects found at 45 CFR 46. This means that when engaged in non-exempt human subjects research, the institution will adhere to the Common Rule regulatory requirements, like informed consent where applicable, as well as IRB review and approval. HHS funds will not be distributed without an FWA. Now, by contrast, if an institution is not engaged in research, there's no need for it to have an FWA. But what does being covered by an FWA look like? To begin with, an institution might have its own FWA filed through the OHRP website. The primary awardee will need to have its own FWA to receive funding. Additionally, it is a good idea for any institution that regularly conducts non-exempt human subjects research with HHS funding to have its own FWA. For investigators that do not have an institution, they may be covered by an institution with an FWA. The collaborator who does not have an institution would be known as an independent investigator. Similarly, for collaborating institutions that do not conduct a lot of HHS-sponsored non-exempt human subjects research and do not have an FWA holding partner may extend its own to cover an investigator who belongs to an uninsured institution. It's also possible that for the duration of the research, a FWA holding institution will designate investigators from another institution as its agents or employees. And this might happen in the case of a survey firm if they don't meet the exception. For more information, consider reviewing our Extending an FWA to Cover Collaborating Investigators guidance, which includes individual investigator agreement sample template documents that you can use. When multiple institutions are engaged in one non-exempt human subjects research study, the single IRB provision found at 45 CFR 46-114 requires that a single IRB be used to review and approve the research. Collaborating institutions that are engaged rely on the single IRB for review and approval of the research. This requirement is applicable to the portion of the research that's happening domestically here in the United States. There are a few exceptions to the single IRB requirement, and those can be found in the regulations as well as on our website. Again, when there are multiple collaborating institutions on one non-exempt human subjects research study, the activities of each individual institution should be reviewed to determine engagement. If an institution is not engaged, there is no need for its work to be reviewed by the single IRB. To determine if a project as a whole is not exempt, remember the questions we had at the beginning of the webinar, and those decision charts that provide more information can also be found on our website. Today I focused on some of the more basic and common aspects of engagement. We have additional resources available for free on our website that expand upon the content of this presentation, including more guidance on engagement, when survey firms are engaged, information on FWAs, correspondence on non-engaged scenarios, which is beyond the basic level of this webinar. And we also have a mini tutorial on the subject. If you have questions about this presentation or anything else, please feel free to email us at ohrp@hhs.gov and we'll get back to you. Thank you for your time. I hope that you found this presentation informative.
Thank you, Michael. Thank you for this very interesting presentation on engagements. Engagement is a really complex topic. I think that your scenarios have helped explain some of these complex determinations. We have about 10 minutes left for questions, and we have quite a few questions. So let me just start with this one. What about exempt research that is conducted internationally? Can I make non-engaged determinations for exempt research when the engaged sites are not in the US?
So I'm sorry, Yvonne, but you said for exempt research, meaning
Yes,
that the entire,
I guess.
okay, if the entire project is exempt, then we don't need to go into this institutional engagement analysis, whether it's located domestically or internationally. I just want to clarify that. I heard you correct that it says exempt research.
What if the project as a whole is non-exempt human subjects research, right? So possibly engagement does come into play, but one institution's part is not human subjects, right? One institution out of this cooperative, non-engaged, non-exempt human subjects research, one institution is doing non-human subjects activities. So for example, a lab conducting analysis on de-identified specimens. Lab investigators will have authorship. How do you think about that one?
So the point I was trying to get across, because we see this come in the mailbox a lot, is that if there's one aspect that's non-exempt human subjects research of the project, then the entire study across all of the partners, all of the institutions, is considered to be non-exempt research. So in this scenario, what we'd want to do is look at that institution, and you said it's a lab that is analyzing de-identified samples.
Yes.
So in that case, it might qualify to be not engaged. What we'd want to do is possibly look at the commercial services exception to see if that's something that this would fall into. And then with that, we want to know if they frequently do this for research purposes, or if it's like a LabCorp type situation.
Well, I think I can add to that too. I think
Sure.
that basically if this lab is not receiving identifiable materials for the analysis, right, then they're not engaged.
I must have missed that. Apologies. I thought it was identified. Correct. Yes, thank you.
Okay, so we have a question from Rachel. Scenario 2 question. What if the nurses just pick up and hold the consent forms and do not answer any questions or describe the research? Would OHRP consider this to be obtaining consent and thus engage the site?
So again, my opinions are not necessarily the OHRP policy. But when we talk about informed consent, it's an ongoing process, right? You want someone who's there to answer the questions, to interact and explain all the terms. What you're describing in this situation is someone who's just picking up a signed document and holding it for the researcher to pick up. I would not consider that to be a human subjects activity that would engage the retirement facility.
Yes, and just to add to that, the idea of obtaining informed consent would engage an institution. It's based on the idea that informed consent, this process is really important. The person who will be doing it should have, quite a bit of information and understanding about the research and be able to answer questions that the prospective participants might have. So like Michael's saying, it's a process. It requires quite a bit of knowledge of the research and be able to interact with participants. So it's the entire concept of informed consent that counts. And it's not so much, oh, I pass a piece of paper over to people, right? And that happens to be a consent form, and that alone itself would not actually, cause the institution to become engaged. Okay, another question. When considering professional recognition or publication privileges, does acknowledgement versus author matter? What is the line drawn from? What is the line drawn for professional recognition and publication privileges?
That's a great question, Yvonne. So if you're going to be acknowledging somebody, I would tend to think that that would go towards professional recognition. I don't know why you would be doing so otherwise. And I guess it also maybe the term, maybe we want to look at the context in which someone was being acknowledged. Um, but it certainly doesn't need to rise to the level of authorship in order to be professional recognition. I'm not sure if you have anything to add.
Okay, another question here. If someone is providing recruitment information and then ask individuals if they are interested in participating and then send that individual's contact information to the research team, would that make the recruiter engaged?
As I understand what you just said, it sounds like they're just providing information, and the recruiter is allowed to ask if a researcher may contact that individual, kind of implying that there might be a transfer of contact information, allowing the researcher to reach out to the prospective participant. So I do not believe that that would qualify for engagement with the institution.
Yeah, this kind of corresponds to one of your scenarios as well, what you were trying to explain. And I think that the confusion comes from the word recruitment, right? I mean, the way that it's being used here is really just trying to find out who may be interested and then providing them with information. Well, finding out who's interested by providing them with some information about the study, and if they're interested in potentially participating, collecting some information for the research team to then go out and explain, and that really in a way starts that potential informed consent process, etc. So just gathering information alone itself and providing contact information for the research team to contact people, it's usually not sufficient to consider that the so-called that group to be engaged. And again, I think there is another question that's kind of related to that same scenario. So question additional, scenario 2 question additional information. By hold, I would mean temporarily holding, collecting. Oh, I think that's already been answered, sorry. Regarding the survey firm, what specifically constitutes obtaining consent? Many surveys are now performed online. If the researchers provide consent text to the firm, that text is shared with participants as part of the online survey. Participants simply click yes if they consent and then proceed to the survey. Is the survey firm considered to be obtaining consent? That's an interesting question.
Yeah, it's a good one. So I kind of would want to also know a little bit more about it. So is the survey, is it the survey firm's platform, right? Are they in control of everything? Are they the ones that are perhaps sending out the link, because that's what we kind of think about as a survey firm. So I'm just trying to think. I would tend to um, I would tend to think that that might lean it towards engagement if they're posting the consent form and someone's clicking yes. They're the ones that are purveying the information. They're the ones that presumably would be contacted if there was a question going through the consent process. Or is this just like a simple radio button that you say yes or no, and if you say no, you're kicked out? As Yvonne said earlier, and as I said as well, we view informed consent as kind of the hallmark of protecting individuals in research, right? So the idea of someone just clicking yes without having the opportunity to really go through and think about things, we kind of would want a little bit more thought put into things and detail. It's beyond just a simple yes or no click to us. But I would err towards they're kind of representing the research team in this manner of having the consent form available. But it's a great question.
Yeah, let me see if I can add something to that as well. So I think that ultimately there's this idea behind this whole thing as whose responsibility it is in terms the ultimate responsibility it is in terms of, like Michael was saying, if potential participants have questions or have issues with the consent, I mean, who will they contact to get answers, right? And so that's one consideration. If in this case, if the survey firm is really just including information text that's been provided by the research team, and somewhere it said, if you have any questions about the study, that you should contact the research team, and possibly just that alone, right, may not engage the survey firm. That also, I think that it will also be important to look at other information, right? So if the survey firm is actually actively, it's a survey firm that is a commercial firm, right? And they're just conducting this, and most of their activities are really commercial activities, and they're just helping out as a commercial firm to do this, then that could also take it out of engagement. So I think you need to just look at more details. In Michael's earlier example in the presentation, that particular survey firm, if you like, right? It's actually a college that actually specializes in doing research surveys, right? So it's not really done for commercial purposes. It's actually most of their work is done for research purposes. So for that reason, that could, if that's the case, if that's the case behind your situation, that could make that survey group become engaged. So you need to look at the details, I think, as a whole. Right, we're already 2 minutes past 1, so we've come to really the end of this session. There are just a few more questions here. Some of them, I can just say, one question relates to whether there's HHS funding. I just want to say that if there's no HHS funding for that research, I mean, engagement is really not a concern for you, because if you remember what Michael said at the end of towards the end of the presentation, this whole idea about institutional engagement, it's really, it relates to whether the institution, needs to be responsible, needs to be held responsible to the federal government, in this case to HHS, right, for getting the money to do research. So if you're really not getting HHS money at all, right, so like we've said many times already, most of what we talk about don't really apply to you. And of course you can choose to use the same concept to apply to your research, because you may have work that is HHS funded, and just across the board it's easier to manage if everything is assumed to be, but it doesn't mean that we have jurisdiction to come after you. We don't, right? If you don't get money from us, we generally don't have reasons to come after you at all. So what we say to you, really, it doesn't really matter so much. All right, so I think that's just a general sentiment I want to reiterate. And for those questions that we haven't answered and that we feel that we understand and we can answer, we'll provide an answer through an email. So thank you guys very much for joining us on this engagement presentation. It is a very complex topic. We get a lot of questions about it. So do feel free, if you have a specific question, to send your question to ohrp@hhs.gov. And next week, we'll be ending with the last presentation in this particular series. Mariana Azar will be talking about informed consent. Thank you very much.